Good afternoon and welcome to the monthly meeting of the Board of Early Education and Care in Massachusetts. Pleasure to see you all and to continue the conversations that we began at the outset of the new year. I'm going to keep my comments very brief. I have been working very closely with the Commissioner and the Secretary on the ongoing space, both the current public health landscape. So pleased to see the testing launched successfully and thrilled to have that for the field. Commissioner will say more about the vaccination space. And at the same time, we've started to look ahead. As you will know, there is clearly strong support at the federal level for the stimulus involving child care funds. We will certainly have more information as that comes to fruition, but nice to see that support too for the field, ideally, not just in the short run, but in the long run as well. So I will turn it over now to the Secretary.
Thank you, Madam Chair. I appreciate it. Welcome, everyone. We were talking in advance about snow and how some folks are going home early. Doesn't look like a lot of snow outside my window, so stay in school. This is my advice to everyone.
I agree.
So I just want to briefly update you all on some collaborative work that EEC and DESE have been involved in with support from my office over the last month or so, specifically related to a webinar series and a new grant program. So first, EEC and DESE have completed a joint webinar series on strengthening local partnerships around remote learning. And the topics of these 4 sessions that were held over a 2-week period in January included, I'll just read the titles: incorporating engaging instructional approaches that are responsive to developmental needs, building strong collaborations between public schools and community-based programs to support young students and their families, engaging students with disabilities and English learners, and culturally responsive approaches to engaging with families during and after the pandemic. So these webinars, which are now complete, consistently attracted 300 to 400 registrants and over 150 participants. The recorded sessions will soon be available online, hopefully by the end of the week, at DESE's Early Learning website, along with the slides that were presented during the live webinars and links to other resources that are relevant to the topics that were discussed. In addition to that, there's some documented cases that are also in the works for collaborative efforts in places like Randolph and Peabody and Lawrence and Framingham, all of which will also be posted online. And as soon as these resources are available, we'll be sending out blast emails to all the registrants, as well as a broader list of stakeholders and constituencies. So hopefully, even though there was strong participation and engagement with the webinars themselves when they were live, people will be able to refer to them, even those who weren't in those sessions, over the next few weeks and months. So hopefully there'll be continued value, not only for the recorded sessions themselves, but also the materials that are being posted along with it. In addition, EOE will be putting out a $6 million RFP this week that we've been developing as part of the joint EEC-DESE working group that organized the webinars, which is designed to strengthen and expand the partnerships between school districts and community-based, mostly EEC licensed remote learning providers. And these partnership grants are targeted towards gateway cities, including Boston, and are intended to support community-wide initiatives that build on the best practices highlighted by the webinars, both in the near term, but importantly also extending into the summer and next school year. So while obviously there's a near-term urgent need for strengthening these programs and partnerships, I think what we're all hoping for and what we're all working towards is building a sort of longer lasting platform, if you will, that we can sustain over time and hopefully continue to get value out of as we go into the next school year and well beyond. And as part of that grant application, school districts will be required to provide a financial or in-kind match equal to at least 1/3 of the grant amount, with additional support strongly encouraged. And the individual grant sizes will go up to $500,000 depending on the scope of the proposal themselves. So I want to thank the folks on the working group, not only for putting on the webinar series and continuing to work on the materials and the guidance, but also for their input in this grant program, which hopefully in the near future will put some resources in the field and incentivize districts and others to contribute above and beyond that in order to strengthen the partnerships that are still emergent on the ground. So with that, Madam Chair, let me turn it back over to you.
Great. Thank you, Secretary. Joni, question.
Not a question, just comments to the Secretary's comments. I participated in a couple of the webinars, and what was exciting was the intersection of both agencies. One of them that I participated in really talked about, surprisingly enough, families and communities. And it was really quite interesting. We had a CFCE provider highlighted on one of the webinars and really talking about how early childhood programs, how families, how the communities and the public schools collaborate. So I thought it was a wonderful public piece. And I'm done with number 2. It's gone. Carry on.
I appreciate the comment, Joni. And it brings to mind something else I wanted to mention, which we had what was probably our final meeting of the webinar working group this morning. And there was discussion about the fact that while there was opportunity for networking among the participants afterwards, relatively few people participated, but that it would make sense, especially as we're putting out this RFP, to provide opportunity for the applicants as well as other interested parties to continue a sort of networking dialogue and hopefully maybe evolving into a community of practice around these different issues, including others that will emerge over time.
I think that's great, like a community team approach. That's great.
Yep.
Thank you. Look forward to it.
Thank you, Secretary. Mary, welcome. Commissioner.
Yes, so thank you so much for the update, and I want to build on the comments that Secretary Pizer made around some of the great collaboration with some of the ways that we are have been working to support our programs to be good collaborators on the ground as well, and ensuring that we have the resources available to them to be able to sustain the increased operational requirements and knowing the operational burden that has placed on them. So I want to highlight that as Chair Lasso said, as we think about the investments and the programs we've been able to start up, that this really is a recognition that that there will be some ongoing need for operational support to change the way that we operate given the recovery. I mean, as we look towards vaccination and coming back to a new normal, I just want to highlight that these do recognize that this is a new normal and that there will be a need for us to think differently and for EEC to continue to identify these ways that we can alleviate the additional burden of the pandemic and the recovery, while also making sure that programs can stay operational and be collaborators on the ground. So in that way that we wanted to highlight the things we've been talking about over the last few months that we're able to launch in the last, since the last meeting, and our progress on them specifically. So as you all know, we had been working to identify a way to continue the support for PPE for our providers. Many of our providers who are small entities have had difficulty being able to take enough priority to get the PPE supplies that they need to remain open and safe, and have had challenges trying to find some basic supplies. And so we were able to work early on with MEMA to be able to get some of the state's supplies deployed. That was through our regional office, and it was a good stopgap, but it was burdensome for our providers to be able to have to go to our regional offices to be able to pick up supplies, and also our regional offices who are worried about trying to support people to all of a sudden become supply distribution sites as well. So this last couple of weeks, we launched a week ago, we launched the PPE ordering for supplemental supplies that our providers need and aren't able to access, they can order up to a month's supply from a vendor who will deliver it to them within a week or two. And so we have heard overwhelming gratitude on the ground for the ability to be able to access supplies, but also for the system, which has been able to alleviate some of the operational burden of having to go pick up supplies. Obviously, if you're short-staffed and you have to send someone to go and pick up supplies, that's really hard. Or if you're a family child care provider, trying to negotiate how you find the hours in a day to do that when your families need care is difficult. So I just want to be able to highlight that is available. It has launched. The first round of deliveries were successful, and that will continue to be available throughout the year to make sure that our providers can stay open and accessible to families as we go forward. Secondly, I wanted to talk about the testing that we had been talking about the last couple of months, that also the pilot program launched this last week, at the end of last week. To date, we have had over 250 tests taken across the state, knowing that as I was at the Braintree site early on the first day, there were people coming in. It was families, a lot of families who had kids who woke up sick or who have been exposed and need to know whether they could bring the child back to childcare, and really talk about the lack of access for testing for very young children. So this is a need that is clearly filled as pediatricians were struggling with being able to provide enough tests for young children. And so that has been great, obviously, for the workforce and staff of our providers and the providers themselves, for family childcare and household members. This is a great benefit as well. We had a little UPS glitch in the first couple of days with the weather. And so the first round of tests got a little bit delayed from our promised 48-hour turnaround, but we're back on track now and have been able to work out that operational glitch in the first couple of days to make sure that everyone's prioritized and that these tests are providing the rapid turnaround time that we had been guaranteeing to our providers. So it's been really helpful to have the philanthropic support to be able to pilot this program, to be able to make sure we're able to work out all of these glitches and know that we have support from the Secretariat and from A&F to help us figure out how to move this to a state contract once we've been able to identify that there is a sustainable need through the pilot program. And so very excited to be able to announce that as well. 9 sites rotating throughout the week. And as we identify where and how this gets utilized and where it's filling in gaps, we'll continue to refine that and identify where and how we need to think about teams that have an ability to meet the needs of our providers. Again, I just want to highlight that one of the key things for that is it is about making sure that our providers can remain operational with quarantine times and making sure that if there is an exposure, to reduce the transmission that is happening or any transmission at our sites and be able to prevent that. We do need to be able to close down, do rapid tests, and make sure people can go back to operations so that we don't have families needing to find alternative care. And so this is a huge benefit to be able to keep childcare safe, as well as making sure that children and families can continue to rely on our early education and care providers to be able to serve their needs during this time when they are having to go to work and negotiate their lives. Finally, I wanted to just touch on the vaccination and just ensure everyone that it's still on our radar, and we still are working diligently with DPH and with the command center to make sure that they have everything they need from the EEC side. 2 quick things I wanted to highlight is that as you look through the information that's being provided by DPH, one of the key areas to note is that being in touch with your medical provider or making sure that you have a medical home, if you don't, will continue to be an important resource for anyone getting a vaccination, and will be a point of information and distribution as the state does continue to scale and have access to the test from the federal government. So we are encouraging our providers to make sure they've been in touch with their primary care physician and all their information is accurate with them. And then assure everyone, I know there's some concern of how will we we identify ourselves as EEC workforce, know that this is a huge concern for our community, and note that we are working diligently to ensure that as we do have access, as the state does receive the test, that we will be able to make sure the operations are in place for our providers and all the information is readily accessible to them. So know that there's nothing being hidden. We are working carefully and making sure that we will provide all the information as it becomes available to our constituency. And that, I just wanted to excited about the meeting today and some of the information coming up. I think we've been able to really tie together some of the initiatives, the budget, and the work ahead to really make sure that we are focusing on achieving the strategic vision of the board. And I really want to also just thank all of you and all of our stakeholders who have been communicating and participating in our engagement process. You'll hear more of the results today, but qualitatively, we have just heard such remarkable feedback on the opportunity to dig deep with us, the opportunity to engage differently upfront as we're planning and thinking about design and implementation, and just really want to highlight that qualitative part you won't see in the data, but I think is really important for us as we continue to identify ways to bring community voice into our work. And with that, thank you for the opportunity to update all of the moment-to-moment information that I wanted to provide in context for today's meeting.
Joan.
I just wanted to jump in with a compliment to the commissioner and also, if I may, to the secretary, because I think one of the things that's so striking to me across what you've reported out is everything from the webinars and the grant program to the PPE and the testing is, I think, reflecting a really important balance between state level action and deferring to local needs. I think that we're hitting a better stride in recognizing the ways in which the state can really be proactive in helping to address shared challenges, in being responsive to local needs, and in supporting local collaboration in ways that are, I think, helping to set the context for folks to do better by providers, by families, and by children. And so I'm just so encouraged by what you both shared, and I just wanted to take a moment to thank you.
It's great. I agree. And I will say, just the kind of unrelenting focus on supporting the providers in the field is just makes me feel very proud to be part of this community. I want to thank the commissioner and her team. When I listen to all the updates, they're both strategic and they're about today and tomorrow and their kids and their safety. And I think one thing that we all need to just keep reminding ourselves is the vaccine doesn't represent a flip of any switch, right? And so the testing and the PPE and continuing to make the daily public health practices available. So this latest portal where we can get a provider can get a month's supply is just so great to hear about. So I just know that I listen to it a lot because I'm in communication with the commissioner, but I will say publicly, like, thank you. And thank you to the field for taking it up, for continuing to do this hard work under very difficult conditions. Carolyn.
Thank you, Madam Chair. I just wanted to also say that I think it's a good step forward with regard to the collaboration. I'm just hoping that I know the amount of dedication and commitment that's been there from EEC and that they've really gone above and beyond. I think that the response of our school districts has been varied. And so I would just like to hear more about how DESE is going to support that work on the go forward, because collaboration always takes both sides coming to the table and reinforcing that. And I know that some school districts are more difficult to engage than others, but having that direct connection with DESE and that support from DESE is obviously a critical piece of that work moving forward.
No question. Absolutely. Other comments, questions before we shift gears? All right, let's launch in. We have routine business, which starts with the approval of the minutes from our January 12th meeting, which I just was reminded, I was like, was that the one, the flooding? No, that was the one where we had a technical difficulty. We started an hour late in the end. So 2 to 4 on January 12th. Minutes looks great to me. By the way, the minutes are very well done. Thank you for that format. I think they're very easy to move through, and I think they make for very good public record. Any edits, amendments, comments about the content? All right, I'll just take a vote that we approve the minutes from the January 12th, I guess we just have a date change, January 12th, 2021 on that first page. So let's change that. And we cannot roll back the clock. It would be nice if it had been the conditions of January 2020, but it wasn't. So I'm just going to make the motion that we approve the minutes from Tuesday, January 12th, 2021. Do I have a second?
Second.
Thank you, Eleonora. And I'm just going to go around my screen. So I'm going to start with Carolyn Kane.
Yes.
Sheila Balboni. Sorry, Sheila, you were muted.
Yes.
Thank you. Joni Block.
Yes.
David Cruz.
Yes.
Jim Kaiser.
Yes.
Eleonora Viegas Reimers.
Yes.
Joan Wasser Gish.
Yes.
Mary Wallachie.
Yes.
Thank you. Approved. Let's turn now to our items for discussion and action. And I think just another kind of shout out. Let's start with data. It's great to kind of start there. Where are we at with the landscape, the families, the field feedback? As the commissioner mentioned, we don't have the qualitative data here, but lots there to keep us thinking hard about supports and moving the work forward. We'll then shift gears to the strategic progress sort of planning update there, and then the budget, and then we'll move to our parent fee vote following on our January discussion. Commissioner.
Yes. So thank you, Chairwoman. I think one of the things that we were trying to do as we look through this is both ground us in the now, but as you highlighted in the intro remarks, is also looking forward to being able to understand as we try to implement our strategic plan at a very different pace and order than we originally intended a year and a half ago as we started on the process, but really grounding us in what does need to actually be put in place and how are we moving the system as a whole in a way that will help us make sure that as we build back, that we are in building back to the system that barely met yesterday's need, but really trying to think about how we look forward, try to predict, project, and try to make sure that the investments are building into something that will really support the kind of excellence that we know our providers are striving for. And so that's the intention of the trajectory today, but then to also really end with some of our next and substantial steps that will help us move this forward with the vote and our ongoing conversation around the budget. So hope that comes through, and very excited to have some of the conversations that we'll have a chance to dig into today. So moving on to the next slide, one of the things that felt was important to really look at, and again, you know a lot of this data, and so I won't try to, or you know a lot of you watch the same news I do and hear this data, but wanted to ground as we're looking at what is happening with families in the Commonwealth right now and across the country. And so one of the things that we see is that there is really more hardship, but also new structures and new demands on our families that will continue to come. So as we look at needing to think about our caseload account and really our safety net that we participate in, of understanding that more families will be falling into some of our vulnerable populations as we and have been, but also as they climb the way out, they will need different and emerging and evolving structures to be able to be able to be part of the economic recovery. And I think that's an important thing for us to keep in mind as we look at this data and we look at ways that we're asking the field questions, is because as we try to balance the stabilize in the capacity we have, making sure people are operational and have the workforce that they need to be able to meet the current needs of families who are increasingly facing hardship. We also need to support our providers to be able to pivot and shift and think differently as parents need different things from them. So I wanted to take a second and highlight this data and really to look into what is happening as we think about our system as not only serving the birth to 5 system as a whole, but also as you look at our caseload numbers, those school-aged children of particularly working families. That is really, I think, a dynamic we have to look at of the job loss of women in the workforce and really being able to understand how economists and demographers are looking at the projected changes that we will see and what that could mean for getting women back into the workforce. But that really also being able to make sure that the services we have are affordable, because we're going to see a dramatic shift in the economics that people are entering the workforce in. Again, I know you know this data, so I'm not going to spend so much time on reading through this, but wanted to highlight when we're looking at this of what EEC is trying to understand and internalize and be able to look through. As we go through what this looks like for families, I also wanted to highlight, as I said as I was addressing the previous slide, of understanding what that means for our caseload. So really seeing our caseload being able to catch up and maintain access for those families who are increasingly having hardship, but also recognizing that that won't be enough to be able to necessarily sustain our programs as a whole. I wanted to highlight ways that EEC in particular is spending some deep time trying to understand what these projections mean. So it's great to say this is where we're at, but one of the things in order to start working with our programs and really understand what will be needed is to get a better landscape of what, or better trend analysis that will help us understand what's the future needed, where are we going? So at the bottom of this slide, you have 3 areas where EEC is deeply embedded in work and trying to make sure that we are building a lens that will help inform not only what is the demographics, how have we lost women in the workforce, but what are we expecting and what kinds of things can EEC do to help really be active partners in the economic recovery as well, and support our providers and being active partners at the community level. One key thing here is for all of you who have been watching our caseload numbers far longer than I have, you'll notice we have a month by month snapshot. But one of the things, particularly as we've come out of COVID, is understanding what are those trends? How do you look at caseload over time? Who's staying in? Who are we losing on a monthly basis? And really, how do we figure out as we look at things like programs reopening in July, schools reopening and going remote over the course of the fall. Where does all of that mean, and what impact did we see for families as we look at projections of our caseload? This is something that was highlighted prior to COVID for us, that this would help be a helpful lens in understanding the caseload projections that you all were grappling with and were seeking to make policy decisions to address underspend, that there weren't really the tools to help do that. And so in one of the things that we are spending a fair amount of time now building is a foundational infrastructure that will help us be able to do these trends for our caseload. So we did contract with Third Sector Intelligence, 3SI, a company that works in this space nationally and has worked with many states and cities and and others to help build some data infrastructure that would help do this. We have started to build that. It will start with our caseload. We'll have the capacity to build it out to look at programs and other types of data and trends that EEC wants to look at. But given where we are in terms of demographics in our state right now, the massive changes we've undergone for the last few months, and knowing that we need to be able to try to glean what we can from trends over the through COVID to be able to inform what it is that we'll need over the next months and potentially years, that this will be a really key tool to be able to build and be able to inform. So we will hope to have data along the way, and no promises on exactly what and when, but we do hope to have some substantive analysis by April that will help us as we look towards the next year. Secondly, I wanted to highlight a regional collaboration that we're working with at the Bipartisan Policy Center. We've just started working across regions. We had been working with the Bipartisan Policy Center to look at supply-demand analysis that they were looking in certain states prior to COVID. And as had Maine, and we looked at the opportunity of them having our data and having some understanding of our landscape. They also work with New York and had done some work with Connecticut, and the region came together and said that we'd like to ask them to do some analysis on parent preferences and employment trends at our regional level. So given some upcoming surveys and things that they had planned, they will oversample and focus on New England, as well as some specific strategies that we'll be able to employ in looking at our industries and our region, and migration patterns that we may see across the region over the next few years. Looking at that, we hope to have more of a report. We also know that looking at where employer trends are going is a key priority for the administration as we think about recovery. And so making sure that this is tightly linked with that, and that we also see where care would be needed for families, as well as what families might be experiencing from the economic landscape, I think will be a key puzzle pieces to keep together, and excited to be able to start some of this as well. And then finally, we have been thinking and working and trying to hope that and thinking across secretariats about ways to leverage expertise that exists beyond education, beyond early care and education, around thinking about what kind of innovation is needed, what kind of innovation we can support, and what kind of connections we might be able to make that would be as that would help drive a community level initiatives that we could help support and be thoughtful on, as we look at the type of employer and care relationships that we know will be critical for an economic recovery. I have been hearing and know substantively that the business community are all considering the work for home strategies going forward. You guys know we did an employer survey. That was a key trend of not sure and how they will structure their work going forward, what industries fuel and foster a work from home ability and which ones don't, and how do you ensure that there is appropriate care and to serve all sectors and also income and community demographics. And so we really want to pull in some of the those who know this area much better with us, and are key in working on some strategies to do so with other expertise and partnerships throughout the Commonwealth. On that, I'm going to pause there as we before we pivot to some of the engagement information we've been hearing from providers. But let me pause there and see, are there any questions, thoughts, trends? Wanted to, again, ground in where we are, but also show what EEC is looking at to help understand where we're going. Yeah, Mary.
Any comments or questions?
Mary.
Go ahead, just jump in.
Mary, it's Mary.
Hey, Mary.
Commissioner, you may have addressed this and somehow I missed it, yelling at our dog for barking. Back to the third sector intelligence analysis. You mentioned, getting some information in, I think you said April, but I'm sort of thinking last year was unusual. The coming year will be unusual.
Yep.
The year before was different than any one of those years.
Yep.
How can we even really take what we learn and in any way, frankly, use it to inform the work moving forward? I wonder if you could just speak to that a little bit.
Absolutely. I think that to your point, when you look at our subsidy caseloads alone, every month, every year is unusual, and every trend is going to tell a different story. I think that the key about what we're building is being able to look at the trends in relation to other data. So looking at it in comparison to census or demographic changes. So looking at, okay, as unemployment change happened, what happened with our caseload? We can looking at it across regions, looking at as points in time of what school districts were making decisions around. And I think that our data, our ability to look at trends in our data will be great. Our ability to look at those trends in relation to what was happening in the landscape at the time will be actually, I think, the instrumental part to being able to try to make some better predictions around what if. One of our challenges is what drove changes month to month, region to region, and not being able to look at that makes it hard to say, well, what if X happens in July or September, and making some safe assumptions or building different scenarios. And so I think that will really hopefully be the core value of this. And then I think building the infrastructure that allows you to do that allows you to then layer on things down the road, less impactful for maybe this fiscal year, but I think down the road to be able to look at program trends. So now having the ability to look at caseload trends and program trends in connection to each other, to be able to understand where and how access to programs is driving, or program location and type might be driving parent access. So I think hopefully that helps explain some of what we hope to glean for the immediate, but also to understand that this is an infrastructure that we will need ongoing and hopefully be an investment overall. Mm-hmm.
So could you say that in a way we're trying to anticipate what the new normal is going to look like with some of this data too, Commissioner?
Yeah, absolutely. And I think anyone who has the crystal ball to tell us what next year at this time we can expect in terms of COVID, money, anything, is just a lot of unknowns right now. But being able to understand how some of the contingent factors impact our families, I think will help us at least understand what we should anticipate in the new normal, if not actually build it.
Anybody else want to jump in before we shift gears to the field?
Just quickly, Dooney. So I see that 83% of pre-COVID providers have reopened. I guess I'm wondering, through this collaboration and sort of work with Jesse, do we know the percentage of school districts that have reopened and sort of that have in-person instruction available? Because I think they go hand in hand, right? Especially since the number of school-age children being serviced by EEC has gone up dramatically during this period of time. I'm just wondering, sort of, as we look forward, sort of, I see them as parallel tracks, but integrated because of need. So maybe you don't know that, and I can follow up with Jesse, but I was just curious if we know that. If 83% of childcare providers are open, do we know what percentage of schools are open? The in-person, I mean.
Secretary, do you know that information?
So we're actually, the department is about to update that survey to find out what the current data is. But basically it's kind of been roughly something like 40% or something like 20% have been fully in person, something like 20% have been fully remote, and then everybody else has been in some kind of hybrid. The important distinction is that some of the fully remote districts are some of the larger urban districts where more of the students are. So those numbers in terms of the number of schools or districts doesn't necessarily map into the number of students.
Okay, thank you.
Yep.
But I just ask, is any of the analysis we're doing, does it involve at all looking at the effect of what childcare, particularly our school age programs, have provided in the way of support for public school children during this period?
So Sheila, in all honesty, our information on that on EEC side is a little bit limited. So we're really very dependent on self-report, and know that's been burdensome for our program. So try not to overly burden them with it. I think that we do know that we've been tracking more of the caseload enrollment than just the services overall. And not sure, I think, have been, I think, through the grant programs that the secretary, that EOE had done previously. And I think this one hoped to maybe gather a little bit more information about what's some of those specific programs and models that are there. Secretary, I don't know if you know of any other lens that there would be around some of that from DESE's side.
I don't think so, because, as you know, they know who's in school and who's not in school, but they don't necessarily know where they are when they're not in school.
Yeah.
And that data is not being collected centrally.
Yeah. So no, and we don't collect any information except for our subsidized program. So that's our only footprint to look at. So.
Any other questions before we move on to the field piece?
Maybe just one more thing, which if we could even collect some anecdotal information about what childcare has provided to students engaged in the public school during this period, it could be interesting,
Yeah. Oh, there is definitively anecdotal data, and we know many of our partners have done, everyone from Neighborhood Villages, Macy, have done work and been engaging people. So we can definitely tell you some of the highlights and send around some of the publications that they've done. And I think on some of that, the hard part is aggregating how many are doing that for sure. But we know that, I will just say that a few trends in that, Sheila, just to address what you do see in this, is one, the ratios are needing to be much lower. And so the kind of one-on-one attention that kids need, particularly elementary school and younger elementary school kids need during remote learning, is taking much more one-on-one attention. And so therefore there's increased operational costs. And then I think the other thing we're hearing is that they are providing, they're working and coordinating a lot of the services that the school districts may be providing, food services, other types of services school districts are providing for parents who can't necessarily access them from the school. So there's also a fair amount of work being done there around trying to make sure that schools are able to help accommodate a caregiver, a provider who may be working with kids across multiple schools, working across multiple classrooms. And I think I've been hearing this was in a different state, but one of the key things that's a key fundamental difference, I think, is that when children are in person in school, you have to stagger lunch times because you need to make sure they all have a place to eat lunch and you can't fit a whole school at the same place. When you are providing remote instruction and our providers are working with kids who are across multiple grades and multiple classrooms, it may make much more sense to have a universal lunchtime where the provider can then accommodate multiple kids across multiple instruction patterns, but still be able to provide the important needs of the kids, the food and the social emotional, the social time and the outdoor time and all of those things. And so things like that are key things that I know our providers are really grappling with, and then also trying to negotiate and work with any liaison or any district point person to try to make sure that they can really help accommodate their operations to be able to meet that need. So again, I can happy to share that and delve deeper into the anecdotes that it's just a little hard to capture beyond just our subsidy providers of who's doing some of that.
Noni, just one more thing before we move on. So I'd like to know if, in terms of the $841 million that's coming in to K-8, or that's what I read anyway, maybe that's not specifically accurate, but before that money gets distributed, are we going to look at the cost to our providers and our families as a way to sort of create some equity? And Secretary, I appreciate the follow-up from Undersecretary Reale, but I'm just, as we hear more and more about what these providers are doing during this period of time, it seems that there should be a reckoning of those costs at some point or at some level.
So are you talking about the proposed federal dollars?
Yes.
So, I mean, the way those are distributed, they are not distributed just through discretion, any discretion on the part of the state. It's by formula to the districts, and there are no conditions that can be placed on them. There is some discretionary money that flows back, in this case, to DESE. Hopefully, based on certainly the bills that are pending, there'll be significant new dollars as well for early education. So there's some combination of discretionary and non-discretionary. Most of the K-12 money is non-discretionary, but that doesn't mean there's not significant additional resources that may and likely will be available for us to apply flexibly. And obviously we ought to be looking at all of these opportunities to make sure that we're getting the resources to where they need to go, where the kids are, and where the services are being provided.
Thank you.
Yeah. And I think this is something we'll have to, as we pivot to what the program vision is, I think something we'll continue to have to pay attention to too, as a secretary, and on what the services and needs of the kids are, is as we look towards summer and fall and trying to understand how we continue to position our providers to stabilize and be able to meet those needs and be able to partner in different ways, and knowing that districts are making real-time decisions as well, making sure that we're in a position to support what might be some alternative needs in an ongoing way for our families and children.
And Carolyn, it's certainly not lost on me, and I agree with you. And I think we've got to think about this looking ahead. I don't think this, not only is it going to be a new normal, but it is not going to be a quick new normal. And the pods will likely continue, right? Which means that there's not a full-time approach to school age. And I take seriously EEC's expenditure up 55% in the school age category. So we have to make sure as a state that, even if the dollars, like when there's a purpose for the dollars and another agency's serving the purpose, we have to figure out how to make that work. So I hear you. And I think Commissioner, Secretary, and I need to keep pushing on this point and making sure that that we get a transparent and strong approach to the funding to support children, right? We all want children in spaces where they are learning safely and in an engaged manner.
And I think that really just brings us back to the idea that on the one hand, as the commissioner is pointing out, there is so much that we don't know, that we cannot yet really anticipate. And it's really helpful to gather data to help us get a better handle on trends. At the same time, I think what the focus on more anecdotal information and projections is pointing out is that there are some contours that we can begin to reasonably anticipate and plan for. Right? The idea that this is not going to be flipping a switch in the fall. The idea that ratios are going to have to remain low, that we know that costs of operation are going to be higher. And even if we can't anticipate the sort of clear mix of infant, toddler, school age on caseload, as more people are vaccinated, it is likely that more parents are going to be called on site for work. And so, we have to anticipate that demand is going to increase, even if we can't fully grasp the nature and cost associated with it. And we have to anticipate that ongoing collaboration and planfulness at the local level to better support families than what is currently going on is going to be imperative. And so I want to make sure that we are balancing both what we don't know with what we do know, so that we can also be proactive.
Yeah, I agree. And we've got to attach to the uncertainty in concrete ways. We can attach to the uncertainty in concrete ways. The dimmer switch is very real, right? And so it's just a matter of what the long, like how long is the tail? Unclear. But the other thing is we got to take seriously the new normal, because it is not going to go back to a 5-day out, you know, for lots of families. There's going to be a much more flexible approach to the work life and therefore the need for care.
Yeah.
Anyway, this is a longer conversation.
Well, and I do want to highlight as we look at, and as you can change the slide to go to the next slide as well, as we look at the new normal and what that looks like, something Sheila said that I think I'm stealing a line that you use. I think our unit of analysis has to look different as well. We've been spending time looking at the child level, and quite frankly, as families right now, what we've learned through COVID are having to navigate themselves at the family level, of trying to help figure out what to do with multiple children across grade levels who may be engaged with multiple systems or have different access. And I think this is where it does setting up our providers to be able to help and think about supporting families and understand the need at the family level, I think will serve them well in helping communities really help navigate and support the contours that we know. And we don't know all of them, to your point, Joan, but I think, but we do know that there will be there will be gradual changes that are necessary for us to be able to return to any sort of normalcy. And so being able to support people to help families navigate those gradual changes, as opposed to go back to systems and go back to the old normal, I think will be a lot of the work that we have to focus on ahead. And I think importantly, doing that in a way that doesn't that really focuses on trying to build and I'm going to say compensate is the wrong word, but fulfill the promise of what we can be investing in, because we know that so many providers are struggling in just providing the kind of services that they strive to do. And so how do we really help define and help highlight those things as we build back? And I think that's where, when we look at this particular launch to our engagement, is really trying to foundationally ground ourselves in consistent and continuous feedback loops, because we do need to figure out how we really start to pivot in a way that doesn't further destabilize an industry that we are going to absolutely rely on to serve families as we move forward. So I wanted to dig a little bit deeper into the ways and how we did that, or how we are doing that. But to start with here, you heard in December when we launched the engagement portal that this would be ongoing. This is the first of something that we will work not to necessarily come back every 6 weeks with a whole new, here's what we're hearing from engagement, but wanted to ground us in this initial one, and then be able to integrate this into our work going forward. As we hear feedback, you'll start to see this more related to the initiatives that we are working on, or the work streams that we're working on in real time. So as we launch this, as I started in the beginning, to focus on something that would be real-time, gathering real-time quick hit feedback, and start to begin opportunities for people to delve deeper into the areas and the content as we are developing them. We know, and when you look at the work across the department, there is so much work going on all the time. And it needs to fit and piece together, not only for us and not only for the board, but I think importantly for the field that has to, and the stakeholders who have to engage with multiple different units and hear and understand a cohesive vision and process of the work, which means it's difficult when we use different terminology across units. It's difficult when we use different strategies or different definitions of quality or different definitions of accountability. And so as we start to call and reconcile those things in a way that can be more customer friendly, we really need to bring our customers in and understand which and how and where some of the pain points are. So we're really thrilled to get this amazing level of feedback in 2 months so quickly, and I think really builds towards the momentum we had in the strategic planning process, but also the real time and genuine engagement that we've tried to build as we've navigated this last 10 months in the most uncertain landscape that I could have imagined in in a new job. And so, you know, I think this has just been a really remarkable product of efforts, not only by individuals across the department, but a willingness of the field to come to the table and start to rebuild and think differently. So you have this here, again, because we won't be bringing this back to you every single month, I did want to highlight that the website at the bottom of the page is changing regularly. We are updating it with different information and using it as an opportunity to not have siloed conversations about people's work, but using it as a clearinghouse for people to bring their work and help communicate so that there is you're not trying to keep up with who's talking about what, but having one place to come to that will be more comprehensive. So if there are things that you're interested in seeing or hearing from the field, this is an opportunity for us to build some of this as well. We'll also be using this as we look, and as was anyone who came and saw me the rant during the strategic planning process. But I think knowing that our outward communication was a challenge for people as well, particularly navigating websites. And again, not thinking about, not necessarily oriented to someone who needs multiple different of EEC's functions, but sort of organized by function, and you may have to navigate through across. We know we're looking into that, and this is a stepping stone towards trying to understand how people engage with us in a way that we can then reorganize our communication and be able to fluidly engage like this over time with some real infrastructure in place. So I say that, and moving on to the next slide, what did we learn? So again, really real time thinking in December and January of where we were and where our initial steps in this quarter would be and what we hope to be able to help inform. You have here again the list of things. I'm going to highlight just where they fit into some of our work, but happy to dig into any of these that seem relevant or interesting to you all. So as you all know, we've been really looking in to our licensing regulations and understanding how we can foster regulations that provide clarity, but yet flexibility, foster the kind of innovation we need. We know our regulations, which our licensing regulations, which I joke with administrator colleagues across the country that our licensing regulations in many cases are as high as the highest QRIS levels, and many of states that started much lower with a much less commitment to quality embedded in their regulations. So we are from a fabulous starting place, but we also know that as we've just been talking about, programs will need to think differently, and we need to find those places that we can eliminate the barriers and really foster the kind of regulations that will, or build the kind of regulations that will really foster creativity in meeting the needs of families going forward. And so we definitely have gotten some initial feedback on that. And look forward to really thinking about how we incorporate ongoing dialogue. There's deep dives into where we are, where people have been giving us both internal staff has had an opportunity to think with us about challenges they see as we bring it to the field and are able to kind of gather those and start to organize our work in a proposal that will be hopefully meaningfully progressive toward, without losing that commitment to quality, meaningfully progressive towards some flexibility providers need in meeting families' needs. Secondly, we use this opportunity initially to get some feedback on the parent fee and affordability of care. I don't think that any of these things will come as surprises to you, but I did want to highlight that this, much like we've been talking about with the parent fee, that there is a dual purpose of this. And one of the things about making it more affordable is not only does that provide access for families, but what we were hearing and what you see here is that our programs have trouble when families can't afford the fees. It affects our program finances. And so being able to make affordable fees is also a financing and stability mechanism for our programs, as well as what they pointed out to us as we engaged with them. As well as thinking about of really where we need to prioritize and the affordability of our fees. again, then looking at have started at a very different place on the educator credentialing process of just envisioning and designing and understanding what the needs of the field might be as we build from a TQ process that everyone knows is in paper and does not necessarily build the kind of innovation we want to build for our educator workforce. But really thinking about some initial phases on that. Got some great feedback, and we'll continue to dig deeper on that in the next couple of months, and look forward to bringing back much more depth of conversation that to you next month or the following. And then again, as we think about program quality, one of the things we've struggled with as we have looked at our new approach to QRIS that we talked about earlier in the last few months, is how you really start to measure not sort of an application for quality, but that continuous quality improvement mindset. And so we've started to ask some questions that will help us understand what tools people are using already. We don't want we want to be able to elevate the good practices that are already in place in the field, and really think about where and how and why people are accessing certain supports in a way that can help us think about how we use those supports as a mechanism for building that continuous quality improvement mindset as well. So again, you have at the bottom the culminating statement that I've been saying, and so I will not read it, but I will also just, I think, highlight again that all of this information is being integrated real time into strategy and thinking, but really important for us to think about what families need, how our stakeholders and our investments are serving to drive the programmatic availability of the services, or this availability of the services that that families need, but also understanding that that we need to do so in a way that's not being done to people, but with people, because they have a lens that is critical as we think about how to real time understand changes at the very local and very local and community level. So I'm going to pause there. Before we pivot to how EEC is focusing on integrating this and looking across the initiatives across the system, just give you one more opportunity to react to some of this or delve deeper in anything you may be interested in. And I'll drink a sip of water.
Can I ask a quick question? First of all, I think it's absolutely fabulous that you are getting this type, we are getting this type of information and really addressing this on an ongoing basis. I'm curious, and I think this might come up later on, not just today, but in the future, as to what types of credit-bearing coursework, what types of professional development are educators looking for right now? My assumption is that much of it is tied to the three tools that we're looking at, the ECHAs, the class, and observations. I'm just wondering, in terms of the specific offerings that we have, what are people asking for?
Yeah, and we do have a little bit of that information, because obviously if people are signing up for something or taking it or tracking it, we're able to get how utilization in our PDCs, for example, or utilizations in the pyramid model, cohorts, things that we've been investing in. So we have a little bit of that, but I think that, Joni, to your point of that's down the road in the next couple of months. I think that's exactly what we're trying to understand is to first, like, what tools are being used at the site level, what kind of resources, where are they turning to for any of the types of resources. But I think where the gaps are is definitely something we're looking for, and what they are. I think the other question is, what are they getting out of this? Because I think that there's a lot of science in adult learning that looks at, right, like going to a training is not actually how you change practice. Now, that is not to say that going to a training doesn't have a place in being able to inform practice, but the behavior change in practice comes in the kind of support you provide after that training and the kind of ongoing reflective, I mean, it's like anything. I would say, like, it takes 6 weeks to break a habit, right? Like, or to start a habit. I think they say start a habit. Break a habit, I think, is longer. But right, so like you have to have that practice, and you have to have the scaffolding, and you have to have all of that. And so I think that those are the kind of ways that we're trying to parse apart the questions of, for a field that may not have traditionally had access to that kind of robust and comprehensive professional development. How do you parse out what they're getting, and how do you ask questions that identify things that they may not even known they had access to, or didn't even know they needed? Or, how do you start a new habit? I don't know how I start going to the gym every day. How does that different than what I did yesterday, right? And so trying to figure out what kind of levers we have, I think, is the really nuanced work ahead to build the kind of supports that will not only restart the economy, but actually really keep up with and transform and really invest in the kind of potential that we know early education and care can have.
I think those are really important points. Absolutely. And I think in Massachusetts, we're rich with some historical activities that we've done related to adult learners in early childhood centers. And some of the initiatives that EEC is involved with right now will also inform our ongoing practice.
Absolutely.
So I look forward to hearing more about the how and the what.
Mm-hmm.
Thank you.
Yeah, and I think that's I think is exactly exactly where we are hoping to build some. I think you guys, the work and the thinking and looking at the QRES structure that you all had really spent depth and time in over the last couple of years before I came into the role. I think really is reflective of the kind of, particularly for center-based programs, as we've discussed, it really is reflective of the kind of ways that we know adult learners really need to be supported in their practice, or adult practitioners need to be supported in their practice. The trick is doing it. And I think we've seen and operationalizing it. And I think what we've seen across the country is you can do it really well in pockets, but it's really difficult to do at scale. And I think that's the wonderful opportunity ahead of us is figuring out how we do that at scale.
Thanks, Sam. I'm going to suggest we move on, just watching the time, and make sure we get to our other items. Thank you. Thanks, Joey.
Yeah, thank you. So when we look at the next couple of slides, when we look at this, I want to highlight that one of the things as we've been grappling with all of this is how does it all fit together? And we have talked about the pillars and the strategies and the pieces over the last few months in depth, and the theories of action. But I thought it was really important to do two things. One, to bring them all together to understand, and I want to fully disclose that there are probably things that are pieces or nuances that may not be fully incorporated in here. So this is still very much an active, iterative process to make sure that if there feels like it's not fit in, where does it, and how is it part of an active system building that we are doing? But I also wanted to highlight on this an opportunity that I think when we designed the strategic plan and came up with a lot of the organizing framework that we thought we'd be addressing at the other end of some of these things. And given where we are at COVID, and as you all have are great at helping me understand and integrate, is that we have to be prepared for the unknown in some ways. And so here we are. The financing is coming much quicker than we thought in this case. And I think because there is a desperate need, right? We know that where we are is, and this is at being families need more, and that that enrollment in childcare is going to fluctuate for the next few years as communities, as health, as vaccinations, as school districts, as demographics, as birth rates, as things change in the landscape, given this huge shock to our Commonwealth and our country, our world right now, that we are going to have to fund and finance childcare differently, and there is a need for us to make sure that the infrastructure is sustained through this seismic shock, but that what that is offering us an opportunity to do, and what I was trying to be able to explain to you as we look at these two slides, is how that has to be seen as an opportunity to really build and integrate a lot of the work that we had been seeing together, but that we don't want to that we want to see all of the trains moving together, but that this financing conversation is vitally important and has been, I think, a lot of the missing link and a lot of the improvement in a way that we are being forced to deal with head on and don't want to lose the opportunity to lead on as we're thinking. So that is the purpose of these two slides, and I will walk through them at a high level, but really want to be able to use this as a grounding place for an ongoing dialogue with the board as we look across everything we are doing and what we're trying to learn and how we're building together, that we really take on the comprehensive nature of what we're trying to undergo here. So you have, again, looking at the financing part. We are in the final throes of finalizing proposals of that. It will continue to think about our FY21 dollars as investing in, as I have proposed, y'all, and been conversing with the field about, in making sure that the dollars that we have quickly get deployed to the workforce that has been showing up every day and caring for children, and in many ways taking the operational hit financially, even if the same resources EEC has been able to deploy costs more to run the programs now. So really, and for our individuals and the serving children, there is a huge mental health toll, and obviously a huge health toll. So wanting to make sure that we are deploying dollars most effectively to those who have been providing those frontline services will be the first priority for us. The federal stimulus funds, I do want to highlight that the federal legislation does include language that requires us to put those funds to those who have not previously received funds. So we will be working across the administration and the legislature to make sure that that's appropriately reflected in any supplemental budget that passes with those funds. But we will be looking to build from the CARES Act lessons of deploying operational dollars to keep people operating through those federal stimulus dollars. And most importantly, I think, just to keep highlighting that as we've looked to the initial state dollars and the federal stimulus dollars, we're keenly aware of the additional federal proposals that are out there, as well as understanding that we will quickly be pivoting to an FY22 state budget conversation that we'll talk about the initial phases of when we get to the budget section. And all of that, that what we need to build as we are learning from these two initial deployments of financing that the field definitely, it desperately needs, is making sure that we are doing any future investments better and more refined based on what we're learning. And so there will be some data collection requirements just as we build that to make sure that we are building a lens that will help us really deploy and be strategic about any next steps as we go forward. Again, I'm not going to read through every thing on here, but I wanted to hit on the program, just a couple key components here. There is the licensing. We've talked about our licensing regulations, where we'll be headed. You'll continue to hear about that deep dive and active iterations of that being thought about. But we've been talking with the field around the CQIP. I think what we've looked at as we've headed through this calendar year is letting go of the QRIS application and focus focusing on the CQIP this year to really hone in on those, that indicator of the continuous quality improvement mindset that we're hoping to start to get a better lens into as a stepping stone this year, and mostly to alleviate the burden for programs that may not have the staff capacity to fill out the full application and engage in all of the activities necessary for the QRIS rating in our old system, which we already knew was going to be transitioned away from. So this really is a way for us to think and actively be testing a new approach to the QRIS as we were looking at this. But we also know that that has to come, as Joni said, with a whole rethinking of where and how do we provide supports for programs around that mindset, and that's actively what we're building. We are excited and will continue to inform around the launching of the first small cohort of UCSO classrooms that will receive some coaching. Really thinking about our PDC and mental health grants that really grantees that are really out there supporting and given the new needs of programs, what does that look like? But also knowing that that our focus, we've lost 20% of family childcare homes in the few years before COVID, and so really pulling that out as an intentional model and asset for Massachusetts as we go through recovery will be another really important component of that. And then also knowing that if we are going to build the acumen to be able to deal with a very big infusion of public financing, that there'll need to be some support for our programs to be able to understand how and where accountability for that financing looks like. And many of our family childcare homes haven't had to engage with public financing, which does have some budgeting acumen, and we want to make sure that people really have those supports to be able to do that. So moving on, again, I'll hit on the other two pillars really quickly, and then happy to pause and take questions before we move on to the budget. Again, really thinking about our educators, you have this, that knowing that there are three core components that we will need to be thinking about of really understanding how we rebuild and revise our background record checks, so it's much more fluid and integrated into a process that our educators can more easily navigate. But knowing that will also take some infrastructure and some vision of the ways that we want to measure competency for that's transferable and a ladder that people can grow into as well. And so looking at all of those, again, we'll spend more time on those in the upcoming months, but I wanted to highlight that those need to happen simultaneously, or we will have programs at the end that financially can be sustained, but run into the same issues of not being able to staff them with people who can really do the work we're expecting to happen in this environment. And again, thinking about the family pillar, again, I won't spend a ton of time talking through all of that in detail because you all know there's so much happening and thinking on this, and in the next couple months, we'll be bringing more information to you on this. But again, really thinking about how and where do we start to invest, learning from, as the secretary pointed out, some of the initial grants that they've done to invest in community through EOE. How do we learn and grow, and thinking about our CFCEs and our other assets and where we might need to think about investments that can sustain or alterations that can sustain and really build that kind of robust community collaborations that will help make sure that there's no wrong door policy for families, and that we are all tracking to the same sort of on track to third grade trajectory in a way that can cohesively and coherently support child development by all adults who need to engage and support that child. So that's where we are on some of this. Again, cognizant of the fact that I'd like to leave enough time for the budget and parent fee discussion. Happy to take any questions.
And we can certainly return to this. This is obviously the beginning of a longer conversation. Appreciate the big frame and the push to take up the new funding in ways that will strengthen, even transform the system. Definitely. Any brief comment or question before we move on? Nikki, welcome.
Thank you.
All right, let's keep it moving. Thanks.
Yep. Excellent. Yeah, and I think as Sheila so said, I think that the real big question here is going to be, how do we revisit that? and really keep on track and be in conversation about it. And so looking forward to bring that back. And it was our first capture of really trying to put it in one place in a way that brought it to understand why all trains need to move at the same place to bring us to a truly transformative new normal. Okay, so digging into the budget discussion, again, remembering that here we are where the governor has submitted the proposed budget. You all supported passed the budget memo that has been posted online for anyone who's interested, that has informed the House proposal that the governor submitted in January. The reminding you where your priorities were and moving on to what the House budget or what the governor's budget proposed. It did continue to keep, as you all remember, as we looked through the numbers, we didn't get, apparently it's a little bit harder to hire people in COVID than in normal times. Can't imagine that. So still fully funded and supported the infrastructure needs for EEC, given the fact that we hadn't completely gone through our full planning process for the last fiscal year. And did maintain caseload funding levels, except, as I said on the page, to the one-time appropriation for parent fees. I want to highlight, and I think that as we look at this, that the commitment to the caseload numbers, I think also recognizes, and there is language in there that continues to transfer the underspend to the operational reserve. And so the commitment to continue the caseload levels, much in the way that you all supported and recommended, does recognize the fact that there will be fluctuations in caseload, but that the operational funding needs to remain there with the ability to put that into the operational reserve and spend it in a way that will allow flexibility away from just a per child fund. So I just want to highlight that the language there, while there is a maintenance of the caseload account, there is also a flexibility in the transfer language that allows us to spend that caseload in response to the numbers and reality we're seeing on the ground. And you all have, moving on to this, and you all have in the appendix more information on the caseload account specifically and where some of the expenditures are. But just want to continue to highlight that this, I think, as someone was saying, that this is an unusual year, and we are, because it's very, very difficult for us to look at caseload numbers and project out in a way. We've been really looking at spending, understanding expenditure rates, understanding the relationship between who's enrolling and what the expense per day or per child is. And so you do continue to see that we have stable spending, but that we have really continued to see drops in caseload, and that we really are seeing decreases in younger kids right now, which makes sense. As parents are making choices based on health and safety, and increases in the school age spending. So I know big surprise here, you have far more detail in the appendix, but I also wanted to highlight as you look through the appendix, is the continued challenge of trying to predict where and how the trends in the way we contract or subsidize. And so we have continued in looking at this and trying to address the enrollment issues, continue to implement policies and support flexibility in who can enroll in our contracts, how we can provide parents as much flexibility as possible given employment fluctuations. But, I think that what this shows is that that's still not necessarily impacting enrollment, but the costs are there for the kids. And we all know that to operate one classroom, doesn't matter if you have 5 or 15 kids in it, you still need the same amount of staff. And so really understanding the operational costs in relation to some of these fluctuations as well. Okay. So again, having the relationship between the caseload accounts and where we see the spending, as well as where just seeing the immense external factors that are driving parent demand. Again, I won't read these numbers to you. This continues to highlight and paint the picture that we were hoping to paint, that this is not only a long-term, a short-term challenge for us to address, but it is also there are long-term factors here. We have been discussing those throughout the meeting, so I won't belabor them, but happy to open it up to questions or thinking as we move forward. I will just end on one bullet point that given all of this, this is why we have looked at those financing strategies that don't look at a per child enrollment, is because when you look at all of these factors, both in what's happening day to day, but also in the continued external factors that will drive enrollment fluctuations over the next couple of years, we really felt like it was an important shift, as Joe's also highlighted at the beginning of the meeting, to be able to look at the cost it takes to keep your doors open, to sustain the capacity we have been able to bring back into the system. 82% or more of our providers are open and operating, and that is from pre-COVID levels, and that's amazing. If we rely on a per child level where it has been fluctuating and we see these fluctuations, where the uncertainty for those providers will remain, and we are afraid we will lose that capacity. And so shifting to this model that looks at how do we support the workforce and how do we ensure that we are sustaining the operations that have been able to come back into place, I think is an important reaction to what you see here.
Commissioner, one of the things that really strikes me as you're talking about the last number of slides is this momentum toward stability in exchange for support and accountability, and how critical that underlying stability is to be able to maintain capacity and be responsive to some of these unanticipated needs, but also how critical that stability piece is for driving program quality over time. And it just really strikes me as, in some ways, mirroring the K-12 conversation 25 years ago. That, within the K-12 space, there really emerged this deep understanding that you have to have a foundational investment as a guarantee in order to support any kind of meaningful educational quality. And I'm wondering if that resonates at all for you, and whether you sort of see a parallel in terms of how the early childhood system might proceed.
Yeah, that's interesting. I think that it is, and Charlie, so if you want to jump in, this area a lot as well. I think that's interesting. I think that there is, I think there's a few fundamental pieces that resonate, and then I think a few lessons that probably have been learned that we can actually incorporate in a way that will help us leapfrog and not recreate some of the challenges. And so I think that the first thing is that the fundamentally, and we know this no matter what it is that we are trying to do in human services or education or social work or lobbying for that matter, relationships matter. And change happens through relationships, and the relationship between a child and an adult caregiver matter. And I think in the very earliest years, when you're looking things like early literacy, one of the things I often will talk to superintendents about in previous worlds or legislators about is like, if you just look at my niece, right? If I don't talk to her for 2 weeks, she's 2.5. I'm not always clear what she's saying when I loop back in 2.5 weeks, right? Things like language skills happen so quickly. And if you are changing caregivers because of instability, or because people see this as a last resort job and are going someplace else, you're having trouble keeping a workforce, the impact on children is that they lose days or weeks of that engage meaningful dialogue, because they know that Baba means this in this context and this in this context, and that's meaningful for 2 or 3 year old. and is meaningful because saying what over and over again has a social emotional impact on a child of, am I understood? Am I making sense? But it also really has that language scaffolding, early literacy impact. And so I do think that one of the things that we've seen really undermine stability in the field in community providers, early childhood and specifically, but I think it resonates across the elementary school age for out of school time too, is without being able to ensure that there is a minimum amount of secure funding, it's very difficult to commit to fixed operational costs. And quite frankly, salaries are fixed operational costs. And so when you're trying to invest in humans who need to deliver your service that are having the impact, instability in financing can really undermine your ability to maintain the stability in those interactions. And I think that's where we have an opportunity to look and think, yes, absolutely, these are interconnected, and why that system slide to be able to see all of these moving simultaneously is so vital. I also think that thinking critically about not just switching and understanding, okay, financing as the key lever. I think we're looking at, and what Joni is bringing up, the ways that we support adults in those programs, the kind of access they need, the kind of ways that we are responsive to what parents need, and not just design something that is a one size fits all, but really understand ways that we can use parent choice to drive the kind of innovation that our providers, we see they want to provide. How do we foster the stability, set the kind of parameters and expectations that will make sure that they are have clear understanding of what kinds of things we know drive those outcomes, and then really try to figure out mechanisms that empower communities to solve problems, I think is the challenge. And I think this is where K-12 has done a lot more in the last 10, 15 years to try to understand how do you empower local leaders to be able to work with like local principals to be able to drive that kind of adult learning, where and how. And I think Secretary highlighted in the ways that Massachusetts is investing in communities in this latest grant, where and how do you foster the kind of approach to a community schools commitment that can really drive taking a comprehensive look at families' needs differently. And I think this is where we have an opportunity to try to learn from all sorts of different sectors and all sorts of different components and try to build that in a way that will foster not only the kind of stability that we've seen, but also the kind of innovation that we've caught up on after those initial investments. That's helpful.
And I just add one more relationship and getting back a little bit to EEC and DESE too. I think what we've learned in the past few months is that it can be a really powerful relationship in support of children, families, and teachers as well, and to keep that in mind.
Yeah, absolutely.
If I may add, I think that it's very important that the same kind of flexibility that we are, in a way, inviting and allowing in terms of thinking, how do we plan budgets, how do we plan services, how do we plan, we also need to think about that kind of flexibility with our workforce. Because if you think about it, quality will depend always on the workforce. You cannot have quality without quality workforce. So we really need to in the middle of all the systems, and I know the difficulty in planning everything, we have to keep the workforce almost as centered as the children and the families that we service. And that workforce, we need to think about it in terms of not only what we do for them, but also what DESE can do for them, even if they are not working in the systems that DESE traditionally pays attention to. But that kind of collaboration demonstrated by the webinars that were so well attended and everything should continue. And we should emphasize that kind of partnership on a regular basis so that we can always keep the workforce also at the center.
Mm-hmm. Yeah, and I think this is, again, it's going to be a challenge coming out of COVID too, to think about this in different ways, because we're going to have to look at families differently, right? As we were saying, of looking at the family unit and not just the individual child, and really understanding then our workforce as a whole, serving that family across sectors, and not seeing, and I think this is a challenge in every community, state, national context I've been in, is not seeing it as a competition for workforce, but seeing it as a collaboration for workforce is going to be, I think, some of the real shift in work that the country has to do ahead across sectors. And it is really important. I think this is going to be, I often said when we were looking in Chicago through all of this, is like, if we get kids to 5 and then send them off into something that the kids don't die at 5, like we want them to actually go and be successful later on. So we've got to pay attention to that integration, but also our workforce doesn't start at an AA or a BA. They come out of a system. And so really thinking comprehensively about how that becomes aligned.
Yep. And the other thing, last comment, the other thing that I want to emphasize, we haven't mentioned the Department of Higher Ed. And I think that we should not forget that we also have in the state a Department of Higher Ed that we should also begin to partner more intentionally than we usually do when we're thinking about our workforce.
Yeah, absolutely.
I think the only thing I'll add to all of this is I'm sitting here struck by how great it is to be having this conversation in the context of the ability to drive up the floor in terms of, I think what I was always slightly conflicted about, and I think this goes way back to conversations with the secretary and others, is in some respects, so much of the QRAS discussions in many ways demand a stronger support and infrastructure for support off the bat to then do the quality, the kind of continuous quality improvement that we're talking about today, which is the human capital side. Like, you've got to drive up the stability in the system for the workforce. To Eleonora's point, the workforce and the quality are synonymous. And the only way one can learn and grow, to go back to Sam's point about even young children that we see right through to adults, is you need enough consistency and stability yourself to have the open learning stance, to set the conditions, to start to collaborate, to start to be a reflective practitioner. And I think what's so heartening to me about the potential positive shock in terms of the dollars coming for the stimulus with the strategic plan and the commissioner's great thinking about transformation, is how do we instantiate the stability in order to then hold to high expectations. I think what always made me a little uneasy about the QRAS, or whatever you want to call it, is we were high on expectations and not high enough on supports. And I think that just doesn't put the learner in the right zone, if you will. So this is very exciting to me. And I really want to, I really look forward to more to come in this area.
Yeah. And I think this is, this is a lesson from QRASs nationally too, and something as we look at financing is critically important. QRASs, there was a lot of money in QRASs that didn't necessarily get to the learner.
Yeah.
And I think that one of the challenges we have ahead is leveraging the systems we have in place, but making sure we're focused on the funding that needs to go to the entity that is going to have to undergo the continuous quality improvement, and not only those that are trying to support.
And I think, to go back to the K-12 and higher ed, like, in the end, this is the hardest work of any field that is practice-based. And I don't think K-12 has solved for it, and neither will early ed overnight. And I think that circles back to Eleonora's point, which is there's so much room for collaboration. And as the new administration keeps pushing the community schools, they're pushing exactly what we're talking about today, which is, how do you actually design comprehensive services and break down some of the silos in the way that we develop the child and support the family in our communities. So it's great.
Yeah, very heartening.
Should we shift gears to the parent vote?
Absolutely. Yep. So starting with a summary of where we were, you all saw this model last time, and we have not shifted anything in it. So you have a summary in front of you. I will give you the recap, but then I think want to spend just a minute on what we're looking at as we head forward into FY22, knowing that that's the context we just set up for the first part of the meeting. Again, this is a fee scale that revises our parent fee structure pretty substantially. It evens out the bands, which has always been a goal of ours, and creates a co-payment that ranges from 4% to 15.6%, being cognizant of an entry point as well as that cliff effect on the other end. We have keeping in mind that we do maximize the federal eligibility at 85% state median income, and so that is a federal cap, but that we have been able to maximize within that. The innovation that we presented last time and wanted to leave you with as we've headed into this vote is that we have been able to exempt all copay, all income under a family's federal poverty level, so that they're not ever paying their copay on that income. This is obviously, you have the data from last time and can continue to answer questions on it, but is a huge benefit, particularly in those first steps, the first cliff that a family experiences of going out of poverty to their first dollar over poverty, and their entire income gets charged. And so this was a way to really become a gradual, more family-friendly approach onto the fee scale, and still maximizing at the high end at the federal cap. So you have this. I will say that the 99% of families that pay a fee, there are large families that, with our change in the sibling discount, or sorry, not the change that said, by maintaining the sibling discount at this, we are, large families obviously pay more for childcare. That is, in looking at the impact of that in our caseload, and also demographically, Massachusetts is a state with relatively small families, and so this is we carefully looked at what would be the mitigate the impact as much as possible, and that again, looking at when that income with that exemption, that we actually have a much lower net for all of our families being paying the fee. I will say there's not other states in the country that are looking at this kind of innovation. So I think this really is an area where we're able to lead the pack on this. But it will take a little bit of implementation. And so we are working on making sure we have a calculator online. It becomes a much more complex model to read on paper. And so we want to make sure there's a calculator available for families, as well as obviously the technology build out. I wanted to address from the conversation we had last time until last board meeting until this board meeting. Obviously, we have more information on the budget as we've looked to FY22 and the budget implications for this for FY22, and feel, obviously, having spent the meeting talking about the uncertainty in caseload, feel confident that with the reductions in caseload that we have seen, unless we see a return to full caseload by the end of the fiscal year, which I think is very unlikely as what we're looking at our trends at this point, feel that we would be able to adequately absorb this without impacting caseload numbers through FY22 in the initial part of with a lower caseload through the summer as we head into normalcy and or the new normal throughout FY22. Obviously, then cost of it goes down with lower children, and also obviously our overall cost of our caseload goes down. So feel very confident in that. Plus, looking down as we look at the federal funding, feel that we will not have to impact caseload, and also will be able to, with our new infrastructure, carefully monitor this to, if there was a potential that there were an impact, that we would quickly be able to bring that to you and address any challenges there. So we will keep paying our parent fees through the end of the fiscal year, as per the GAA requires us to this, and we will be working in the full regulatory integration of our parent fees with our subsidy regulations that you'll see in the next few months. But wanted to make sure that requesting the vote so that we can start with implementation and approval of it as we integrate the other parts. So with that, I'm happy to answer questions and or any information you need.
Just to say bravo to you for taking on this challenging task. It really is incredibly challenging. And so we all thank you for that.
Thank you.
Yeah, when you land on a more easily messaged solution, it's especially great, right? Because it suggests implementation for all stakeholders will be more straightforward than when we're trying to explain something even among us that feels confusing. So I particularly appreciate where this all landed.
Thank you. And I want to thank, in particular, Secretary Pizer for some of the initial questions that even led us down this path. And so I just thank you for the support and being able to really think creatively about some of this.
Well, it's very kind of you, but you and the team did just a huge amount of work to get to this point. And I think where we're landing is a, clearly an equitable solution and a progressive one that is going to be a big benefit to families. I think hopefully create more stability for providers, and enable us to sort of address the other parts of the finance system, which we were talking about earlier. By making sure we've dealt with this particular piece, which is such an underlying core value of the system and bedrock for the way in which early education is funded. So in many ways, this is kind of clearing the decks and setting the foundation for the work ahead. So thanks for all of that.
Yeah, I couldn't agree more. And I actually kind of feel like that's been the thread all the way through this meeting, which in the middle of a public health crisis that has in many ways devastated the work. It's just very inspiring to do this work, both crisis management and support on the ground while moving things forward. And I really want to underscore that. It's just really inspiring to be in this meeting and think it through this way. Other questions or comments on the parent fee piece, which I agree is really progressive and really equitable as a strategy.
I really want to echo both Noni, the chair, and the secretary's comments. I mean, I'm certainly in favor of this change. At the same time, I really feel compelled to just sound a small note of caution as we go forward, because I think as we look at the impacts of the pandemic, as we anticipate the economy opening up, we know how hard hit families are. We can expect that there will be more families eligible through TANF. There may be more children coming in through DCF. All of that puts a much sharper burden on the IE line item. Potentially, we're going to have more families that may be income eligible as we look ahead. So while I totally support the foundation here and the concepts and the idea of making this more affordable and accessible for families and wanting to improve stability for programs, I'm also just mindful of the fact that this is not costless and that we cannot afford to allow access through the caseloads to go down. And so I just ask that as this moves forward, we continue to really closely monitor that so that we can ensure continued access, particularly through the income eligible line item, because I think we're going to have increasing need over time. And we're going to need a strong commitment across the board from the administration and the legislature to continue to fund the parent fee component in order to continue to create that more stable foundation for financing within the system. So I appreciate all the hard work, but I just really want us to also be mindful of the potential impacts that we need to be attuned to at the same time.
No, I very much appreciate that. And I think, the secretary and I have thought and talked about strategies as we monitor this, that we can make sure, and I know the secretariat, supports investigation into those as if we do encounter that. I'll let Secretary speak for himself, but has expressed support for investigating into those if we end up in a place where we do fear that we would have an impact on caseload.
Yeah, and just to pile onto that, I mean, we're at the beginning of the budget cycle, as you know, and as time goes by, we'll have better insight into what's going on with the caseload, and we'll just revisit it as we need to.
Yeah.
Thank you.
Any other comments, questions on the parent fee piece? Also, just want to remind us, this partly came out of class action lawsuit, right? So this was not, also want to suggest that the commissioner didn't necessarily decide to take up this thorny and complex issue. So I also appreciate that it started from a not so good place, and here we are.
Lemons out of lemonade sometimes. There we go.
That's right, exactly. Okay, shall I go ahead and make a motion, and we'll take the vote? I will, does that work for folks? Any last comments, questions? Sorry, it's hard when we're not on gallery view, but I think I'm gonna quickly scroll through, make sure. All right, we good? I don't see any hand raised. So I will make the motion that the Board of Early Education and Care, in accordance with Massachusetts General Law, Chapter 15D, Section 2, and Chapter 73 of Chapter 227 of the Acts of 2020, hereby approves the commissioner establishing and implementing the proposed revised parent fee scale, and authorizes the department to initiate a public comment period and public hearing pursuant to Massachusetts General Law, Chapter 30A, within 30 days. Can I have a second?
Second.
Great, and I will just run through my screen. Eleonora Villegas-Reimers.
Yes.
Sheila Balboni.
Yes.
Joni Block.
Yes.
Jim Pizer.
Yes.
Carolyn Kane.
Yes.
Mary Wallachie.
Yes.
Joan Wassergish.
Yes.
Dave Cruz.
Yes.
Nikki Ruiz.
Yes.
And I think that's everybody. Approved. Thank you very much, Commissioner. We turn it over to you and your team for the real work to begin.
Thank you so much. Before we close out the meeting, I was just hoping to just highlight that in particular. I so appreciate all of the support, the conversation, and I just want to recognize that while I get to be the one here discussing this transformation and this and all the strategies with you, that this really is reflective of an amazing, incredible EEC team that has done yeoman's work amidst not the parent fee, just being one tiny piece of what is going on across the department, not only to maintain and keep our programs, our families, our educators responded to, and making sure that they have the information they need, and sometimes information that we got moments before and are trying to be responsive to, but also this immense change and learning that they are going through simultaneously, both in response to COVID, in response to how we do things differently, in response to having a new commissioner who just is a little different, and just really want to give a shout out that this is because of that amazing team, and that we will be coming. Also, we've done a staff survey to try to gather and understand where we can help improve and support them, and just want to highlight that that the team, despite all of this, all of the overworked, all of the trying to balance their own lives, have really responded with an overwhelming commitment to the mission, to the vision, to the willingness to show up and work with their colleagues every day. And I just would be remiss if I did not really get heartfelt about how much I appreciate working with them, how much support and how much just really amazing ingenuity, commitment, and continued passion for this work that we see every day across all of our regional offices, all of our teams and units, and even those who have just joined us as we expand the team. So thank you to all of them, and thank you to you for allowing me to really give a shout out to the team that is working around the clock to make all of this happen.
I have absolutely no doubt, and couldn't agree more that this is just a really challenging time, and there is so much opportunity on the horizon, and it's hard to believe what a year it's been. So thanks to you too. And thank you all, the board, for your ongoing support, your conversations with the commissioner, with me, with the secretary and others, and we'll just continue to keep in touch. And lastly, I just want to close again by thanking the field, who are working hard every day under tough conditions to support the children and families in Massachusetts through this time. So thank you all. And we'll look forward to another conversation in a month.
Great.
Thanks, everybody. Take care.
Thank
Thank you. Bye-bye.
Bye.
Bye.